Measles will always show you if someone isn't doing a good job on vaccinations. Kids will start dying of measles. You may be asking yourself, why should I care about measles? Before vaccines were developed in 1963, each year, almost 3 million children died around the world because of this viral infection. What is measles? Measles is referred to also as rubeola or red measles. It is a highly contagious, vaccine-preventable viral infection. Symptomatic illness, that is symptoms accompanying the infection, develop in over 90% of susceptible contacts. And most infected children are sick and miserable for many days. I'll say more about that a bit later. How common is measles? In the pre-vaccination era, measles was almost a universal experience during childhood. Indeed, more than 95% of children contracted measles by 15 years of age. The incidence, the frequency of measles, dramatically declined after the introduction of measles vaccine in 1963. And the infection was virtually eliminated in the United States by 2000. However, in 2019, there was a resurgence with more than 1,300 cases of measles reported in the United States. This is the greatest number of cases annually since 1992. Over 90% of those confirmed cases were amongst the unvaccinated. And measles remains a major cause of child mortality in low-income and middle-income countries, especially in Africa and Southeast Asia regions of the world. The estimated deaths worldwide due to measles in 2018 was 142,000. How does measles spread? Measles is a highly contagious viral infection. One infected person typically infects between 12 and 18 others who are not immune to the infection. That is, they have not had the infection before. This can be contrasted with somebody who has an influenza infection, who typically infects 1 to 2 others. Measles is transmitted by contact with respiratory droplets, either directly from an infected person or from a surface that infected person has recently touched. Less frequently, the virus spreads by inhalation of airborne droplets. Measles virus can live for up to 2 hours in the airspace after an infected person has left the room. Therefore, you do not even need to be in direct contact with a person with measles to contract measles from them. The incubation period for measles, that is the time from your coming into contact with an infected person to the time that you begin to have symptoms yourself from measles, is between 10 and 14 days. People who come down with measles are themselves contagious from about 4 days before they develop symptoms to about 4 days after the rash of measles begins. So you can be infected from a person with measles before they have any signs of the infection, and for several days after the infection has started. What are the common signs of measles? After the incubation period of 10 to 14 days, there's usually about 2 to 4 days of mild illness characterized by fever and usually some combination of a cough, red eyes, often referred to as conjunctivitis, and runny nose. When the rash starts, it's usually splotchy and it starts on the forehead and behind the ears. And it usually begins at the peak of the respiratory symptoms, the peak of the cough and the runny nose and the red eyes. And then the rash spreads within 3 days down the entire body. The rash usually lasts for 3 to 5 days and then fades from a red color to a copper color to a brown color, and the skin may peel as the rash resolves. The rash is usually accompanied by a high fever, as high as 40 degrees Celsius. That fever peaks 2 to 3 days after the rash onset. The rash may be itchy, but more often than not, it is not itchy. After the fever peaks, the rash and the other signs fade away unless there are complications. Questions covered in the next video. What are the complications of measles? Are some people especially at risk for bad measles? How is measles diagnosed, and how is measles treated?